this is first of hopefully 2 or 3 small short dissection videos. Here's Patrick. Hi, Patrick. Here's the cat that is still in a bag and sealed. Here are the tools that Patrick is going to use today to dissect. And Patrick, you want to go ahead and cut the plastic. He's gonna cut the bag away from the head of the cat so we can keep most of the plastic intact. So after your lap is done, you can put the cat in the same bag. Now, if you notice, there's a little bit of preservative fluid in the bag. So keep that in the bag, as it'll keep your cat moist throughout the semester.
So I'm going to go ahead and pull them out. Yeah, you want to try to avoid making too much of a mess with the chemical fixation fluid in there. So I try to hold it over the tray. When I'm pulling them out, you see it's going to drip a little bit. And you're going to have some fluid left in the bag. And like Dr. Parisi was saying, you want to keep at least some of that fluid in there, because you're going to be putting this cat back in the bag after each lab, after each dissection, and having a little bit of moisture in there will just help keep it from drying out, which will make the actual dissections of the muscle just much easier. Once they dry out, it becomes much more difficult to actually move the muscles around, and they just become less pliable, kind of turn into beef jerky. So this is what he's going to look like, and I'm going to place my bag somewhere, at least relatively safe. So I kind of fold it over, and then And then for the first dissection, so these cats are already skinned. So you'll notice, you can see there's a little bit of skin on the hands, on the head still. So what you're looking at and what you'll be working with most of your actual lab dissections, you're going to be starting with this superficial layer here, which is mostly fat and fascia. And the first dissection, you're going to have to do quite a bit of cleaning. You'll have to clean throughout most of the dissections, but the first one's going to take the cake as far as the amount of cleaning you have to do. So what we want to do with this first dissection is look at the axial musculature on the chest and on the back. So the first thing I'm going to do is take some time here to clean from around where the rib cage is, right here, up towards the neck. And I'm going to peel off as much of this stuff as I can without actually peeling off the muscle. You'll see, so this right here, this yellowy stuff, this is fat. And then this right here, this is fat. That's just trash. We just want to cut that off. But you see, whenever I peel it up, and there's this sort of spider web kind of action happening on this clear tissue over the muscle. So you can see a little bit of muscle right here trying to peek through that sort of pink color. This clear tissue that's over the muscle is fascia.
Patrick, would you please show us with a pair of scissors?
Yeah. So one of the easiest ways I have found is to use tweezers, especially if you're not sure if you're peeling at fascia or you're peeling at muscle. I'll just take tweezers at that first layer and do kind of what I was just doing with my fingers. So kind of peel a little bit up, and then kind of start you can kind of get a little bit of a rip there, and then you can kind of start working your scissors underneath here a little bit. All right,
And I might add, you may also use the scalpel.
Yeah.
If you know, sometimes scissors may not do the job. You can use the scalpel to move that clear or yellow fascia that Patrick was showing you guys, to just kind of scrape or shave it off of the muscle, and you can see, start seeing the muscle fibers.